March 14, 2012, my son Thomas lost his battle with the disease of addiction. I now belong to a club that no parent should ever belong to. Do you know the signs? Do you know the trends that children are doing in today's world? Do you know the signs and symptoms? Do you know the signs and symptoms of drug abuse? I want to empower and educate Long Islanders by bringing a force of professionals and how to prevent the disease of addiction. Long Island in Crisis. Good evening and welcome to Long Island in Crisis. We as a country are facing a nationwide epidemic, opiate and heroin abuse, and we are losing too many people. We are losing a generation, we're losing mom and dads, we're losing too many loved ones to the disease of addiction. It's time to step up and empower yourselves, educate yourselves, and get involved. The time for not my family, not my child is over. It's anybody's family, anybody's child. And I also believe that we must be responsible for each other and each other's families. You know, on the MTA in New York, if you see something, say something. We have to go back to that. When I was a kid, I could be 3 blocks over and my mother knew what I did before I even got home. And I think that's a better way to live. We need to be concerned for each other. Tonight, I am so pleased and honored to have Rich Buckman, who is the president of Long Island Recovery Association, LIRA. He is the past president of, I'm going to let him tell you all the things that he is, because he is a force that you better not try to reckon with. He is a person in long-term recovery and gives everything he has to the movement that is going on in today's world. And before there was a movement, he was so involved. Thank you, Rich. Thank you for joining me.
So nice to be with you.
Excellent.
Thanks, Linda.
So give me your little bio.
Briefly, to add to the LIRA stuff, I was the founding president of Friends of Recovery New York, which is a statewide recovery community organization. Does similar things to what we do here at LIRA, but on a state level. We started that particular organization back in 2008, and then LIRA we started, back in 2000. So we're going on 16 years locally.
Wow. At
Long Island. I'm also blessed to be the board chair of Faces and Voices of Recovery, the national recovery advocacy movement based in Washington, D.C. So from my perspective, I think Long Island is very well positioned. We're plugged in very strongly here on the ground on Long Island, also connected at the state level and then across the country through Faces and Voices. So we're as plugged in as anybody in the country.
Long Islanders are passionate people, and New Yorkers in general don't take too much. We're doers. We're not sitters. So whatever we can do, and I shouldn't say that because there are plenty of other states. And last year at the Fed Up rally, I met many other passionate people that we all need to come together. And we need to have a response from the candidates certainly running for president.
Absolutely.
And we should have had a response from our sitting president, but cut money from the DEA and then put $2.5 million. I mean, what is $2.5 million on a national level? Nothing. So, tell me about LIRA.
Well, LIRA, as I said, we started this organization way back in 2000 on a frigid, snowy winter night. A bunch of us met in Mineola. Some people don't know this, but LIRA was an initiative of LICAD, the Long Island Council on Alcoholism.
Oh, I didn't know that.
Way back then, yeah. Jim Devine, who was the executive director at the time, was connected to a woman named Ruth Maxwell from up in Rockland County. And there was some federal money being rolled out to try to get something going around the area of recovery. So Jim asked a whole bunch of us who kind of worked in the field or were in recovery to to kind of come meet with them and see if we could explore the opportunity about maybe doing something. So there was a lot of energy. There was probably over 50 people at the first meeting. We were buzzing around, and basically what we discovered or agreed upon is that we needed to have a voice that represented people in recovery. Our voice had not been heard traditionally because of anonymity and the 12-step affiliation, which still is a cause of concern for some people. But so we got together, we decided to form the organization, and we, ever since then, you know, we continued to stay the course. And
let me ask you,
sure,
what was the difference in 2000 with the epidemic, or and in today's world? What do you see the biggest difference of?
Well, I think we were just on the back end at that time of the cocaine and crack epidemic. You know, the cocaine epidemic is what I got swept up in personally, which was my downfall, if you will, that led me to recovery. And at that particular time, the need for an advocacy movement was just starting to percolate around the country. Now, I'm talking January of 2000. The following year, in 2001, in Minneapolis, a summit was held, and out of that summit, Faces and Voices of Recovery was launched. So what they did was they kind of reached out to different people in different places and asked them to come to Minneapolis. But to show you how it still wasn't connected back then, we were in existence for a year and a half already, and nobody knew we were here, so we weren't invited. So you know what I mean? So since that time, a lot of the connective tissue, as Bill White, our great historian, talks about, has been put into place, and we have connections. So those kinds of things will never happen again. We're plugged in everywhere across the country.
Excellent, excellent.
Yeah.
And what do you see about this epidemic in you know, in the last 5-6 years, with the opiates and heroin being so readily available and sweeping? You know, I had John Venzi here a few weeks ago, and when you think of a 12 or 13-year-old shooting dope, wow! You know, it still always, at 12 years old, you should be riding your bike and just have absolutely no thoughts of anything in your mind, really, except what you're doing at the moment in time that you're doing it.
Agreed.
So is society, is there so much pressure on these kids? What's your feelings on that?
I think it's probably a combination of all of those things, Linda. I think one of the things that we may minimize is the presence and emergence of social media and how quickly and easily people could connect to things. There's statistics out there that show that young people are influenced by other people posting about their using and drugs and alcohol on the internet and things like that. So, I mean, these are some variables that were not present when we were younger. So, I mean, there's some of that. And then we also know that, you know, drug epidemics seem to be cyclical. You know, it'll be cocaine one time, and then maybe crystal meth another time, and then heroin. It's not the first time we've had a heroin epidemic,
it's
but
true.
it's the most serious one we've ever had, for sure. And, you know, fortunately, or we all hope that because of everybody's efforts, we will get through this and stem the tide and get people help and prevent overdoses. And then, unfortunately or regrettably, in a year or 2 or 3, another drug will be on the scene.
Another drug will be, yeah,
So
unfortunately.
Yeah, so a lot of it is about prevention and education.
Yes, so education, doctors' education. I know last year and I'll share a story with you, and I'm not, just recently my youngest son was in the hospital for a pretty serious back injury. And when we were leaving the hospital, I told them in the emergency room that I lost a son to addiction. No one wrote it down, no one did anything. When we were going to, you know, the day before he was discharged, I said, we're going to send you home. I said, well, what are you going to send us home with? And it was Percocet, and 60 of them. And I said, we have the disease of addiction, and he lost his brother. If he takes it as directed, he will not have a problem. And, well, you can imagine what my reaction was. And then I was cognizant of my son laying in bed giving me the, please, don't climb over the bed and jump him up. Look, but he came home on a Sunday. He only used 2 of those Percocet. I demanded a prescription for ibuprofen, which was more effective on his pain. And on Wednesday, from everything that they had given him in the hospital, he woke up with a headache. His blood pressure, you could see, was elevated. He was sweating. He was twitching.
Wow.
He was in withdrawal. If I had not been educated and we did 15 days of 4 pills a day as directed, you know where he'd be right now. So that is sadly has to be corrected. So that's why parents or family members must be educated on what those drugs do to you, and the doctor needs to be educated. I mean, I don't understand I don't know if it's arrogance or not being wanted to be mandated, but a doctor should want to do better, always, right?
Yes, I agree, and we both know firsthand from our frustrating efforts last year to make something happen at the state level here. I used to run into you coming out of the elevators in Albany, if you remember, but we were very passionate. We worked very hard. We just weren't able to get it done last year, and the medical society is a very powerful and potent lobby. We're hoping that we can kind of cultivate and bring in doctors, I think, by offering an olive branch and trying to meet with them and encourage them to help us work with us, help prevent lives.
Absolutely.
It's
not a fight.
Right.
It's a collaborative effort to do better.
It should be. And we're fortunate because we are plugged into some conscientious physicians here on Long Island that are supportive, and hopefully we can continue to move that forward. I mean, next year's an election year, so it's more likely to be a contentious issue.
I know when I was there, I reminded especially assembly people who they work for.
Right.
They don't work for their campaign contributors. They work for the people of the state of New York.
Yes.
And they will be reminded of that this year. Because as equally passionate as I can be about advocating, I can be equally as passionate about not getting them reelected. So
sure.
I have no problem doing that because you need to stand up for what's right, not for what's convenient. So what's going on in Washington, D.C. this year?
Well, there's so many things that we're involved in now, right? I don't know which one's next. Rock and Recovery comes first, but we'll get to that.
That I want to spend a little bit more time on.
Okay. On the weekend of October 3rd, 4th, and 5th.
Yes.
5th is a Monday, so technically it's not a weekend. There's a number of different things that are taking place in Washington, D.C., where people from all over the country are being summoned and asked to come to Washington to lend their face and voice to addressing the opiate epidemic, to boosting the possibilities of recovery, to making legislators and other politicians aware of the need to act now. We're on the periphery of what's going to be a presidential election late next year, and we need people to understand that we are, in fact, a force to be reckoned with. And we weren't able to do anything like this a long time ago. I mean, this rally on the mall, the National Mall in D.C., has been bantered about and talked about for a number of years. This year, folks think it might finally be time to be able to get 50,000 or 100,000 people to come to Washington, D.C., and then lend their face and voice. So on Saturday is the Fed Up rally that you mentioned earlier.
And that's specifically really against the FDA.
Right. Well, that issue is more dear to you than me, and you're better informed on that one. But it's really important because now a lot of those folks who are going to the Fed Up rally are also going to stay, because on Sunday is what's being called Unite to Face Addiction, major campaign. And I'll just say this first. Facingaddiction.org is the website, so you can go there and get all kinds of information about what's happening there. So we're very heavily involved in rallying and bringing people from Long Island. Lyra has 2 buses that are already going. There's at least 2 or 3 other buses that are going, and we're hoping to get some other buses from New York State. So some people will be going for just Saturday, some people will be going for Saturday and Sunday, and then on Monday is Advocacy Day on Capitol Hill. So folks are going to be spoken to and prepped and an advocacy training will be provided so that people can go to their federal representatives and address, a couple of common themes. The two particular areas of focus this year will be the Comprehensive Addiction Recovery Act, affectionately known as CARA, which will continue to do some of the things we're talking about here to help combat the opiate epidemic, put more money into Narcan and naloxone trainings, money for first responders. It's also got components to a young people's component in there that will help address the issues with young people, including money for collegiate recovery programs.
That's awesome.
Recovery high schools. It also has a component in there for women who are pregnant, veterans, and it also provides funding for recovery community organizations. So when they say comprehensive, this bill really is comprehensive as far as our issues go. So that's one focal point that we're going to
I'm going to hold you on that, and we'll be right back after this commercial.
Okay, great.
My name is Dr. Robert Brevard. I'm here for Multi-Medicine in Westbury, New York. We're located at 1065 Old Country Road, Suite 214. Been here for about 15 years. The practice has medical doctors, physical therapists, chiropractors, acupuncturists. We also do pain management, and we have orthopedists on staff. Here at Advanced Multi-Medicine Rehabilitation, we've got physical therapists on staff who treat an array of conditions, from neck pain to back pain, shoulder pain. We treat carpal tunnel. We treat a lot of car accident patients, slip and falls. We treat patients with knee injuries, with ankle injuries. We have state-of-the-art equipment. We've been here for over 15 years. Vast array of diagnostic testing, from x-rays to EMGs. What is an EMG? It's a diagnostic test that allows a doctor to determine where the pinched nerve is. Cora is a physical therapist at Advanced Multi-Medicine and Rehabilitation. She's working on Stephanie, who was involved recently in an automobile accident. Stephanie has tight thoracic and cervical musculature, and Cora is doing some myofascial release work and some therapeutic stretching doing it to help her with her pain. Vicky is also a patient here at Advanced Multi-Medicine and Rehabilitation. Vicky is now working her leg muscles, specifically her quadricep muscles, trying to strengthen them after an injury she sustained. If you find yourself in need of any type of physical therapy, please don't hesitate to call Advanced Multi-Medicine and Rehabilitation, located in Westbury, New York, in Suite 214. Phone number is 516-334-7000, or find us on our website at advancedmultimedicine.com.
Welcome back to Long Island in Crisis with my special guest, Rich Buckman. So, Rich, we were just talking about the October 2nd is the Fed Up Rally. 3rd is the Fed Up Rally. The 4th is going to be
Unite to Face Addiction.
Unite to Face Addiction. Steven Tyler, Sheryl Crow, Joe Walsh from the Eagles. Who else? I mean,
some of these other names are big names too, but not to me personally. Must be
right, right.
The Goo Goo Dolls.
The Goo Goo Dolls.
The Fray. I have heard of the Fray.
Yes, absolutely.
And then there's supposed to be some other special unnamed guests, so who knows? Maybe we'll get
you know, so for nothing else, show up, show support, show solidarity for, you know, Unite to Face Addiction, and listen to a great show that day.
Absolutely, absolutely.
It will not go unnoticed. You know, and that's the thing that needs to come out. And thankfully, all these celebrities, because for some reason, you know, once somebody, you know, you with, how many years do you have, Rich?
27.
27 years. Not as important to the American public, which is baloney, as Steven Tyler. But It doesn't matter who gets the message across,
That's
as
it.
long as the message gets across. That's the one thing that we have to always take away
Yes.
too. Don't shoot the messenger. Just let them keep coming.
Yeah, as long
So-
as they're bringing our message, we support them. Yeah.
And fortunately, I guess, in New York State, for our federal representatives, I know we have Lee Zeldin, who was active in New York State, and now he's on a federal level. And we have Schumer, Chuck Schumer,
Right.
who has always come out and stood with us.
Yes.
And Kathleen Rice, right, who did a great job in Nassau County when
Right.
she was DA.
And we're hoping she's going to do a good job at the federal level too.
Yeah. So, and they're relatively, I guess, freshmen. Is that
Well,
what they
Kathleen
call it?
Rice and Lee Zeldin are freshmen.
Yeah. So I guess it takes a little while to get your feet wet.
Well,
But
I mean, I'll say this about Lee Zeldin, whether you agree with his politics or not, he knows our issues. He's supportive. He was supportive when he was a state senator. And he was the first congressional rep to respond to our request to become a co-sponsor of the CARA bill. So Lee Zeldin signed on.
excellent.
Sent him a letter. His rep called me, absolutely, be glad to sign on. Let us know what else you want us to be part of. It hasn't been so easy with the other congressional reps, and that's part of the campaign that we're working on now. I mean, I think my sense is that because in the House it's a Republican bill, the Democratic congressional reps are hesitant to sign on.
I'm so
and
tired
the
of
same
hearing
way
that.
in the Senate, you know, opposite, but they need to know that addiction is a bipartisan issue. They need to sign on. Both of these bills do have bipartisan support. The
A
Senate
life is a
bill-
life. It really doesn't matter if it's a
Whether it's-
Republican life or a Democratic
Exactly.
life.
So we're targeting them. We'll be doing a lot more of that. You'll be part of it, of course, and hopefully our goal is to at least get the other 4 representatives who cover Long Island in some capacity, including Gregory Meeks, who does Western Nassau and Queens,
Okay.
along with Steve Israel, Peter King, and Kathleen Rice.
Yes.
So we've reached out to all of them. They haven't been very responsive yet, but they need to know that we will not stop until we get their support on this bill.
Okay. Well, game on.
Game on.
Now, on September, is it 20, it's the
Fifth.
25th, Rock and Recovery Dance. And I think that's one of the best nights because it's free. It's a free event.
Absolutely.
All people in recovery, just come and have a great time. I know you give out scholarships.
Yep.
And I know that Rosemarie Oliveri is,
Yeah.
yes. And,
He's one of
and-
the recipients
yes.
this year.
and that's awesome. And Dr. Jeff Reynolds and Terry Kroll being honored. So tell us a little bit about the event.
Well, Rock and Recovery, this will be our 7th annual Rock and Recovery event. It's developed into something that everybody looks forward to. I mean, the idea behind this was true to our mission and what we all work towards here on Long Island. That we felt like, in part, to help address this epidemic, that we needed to let young people know in particular that they could have a good time,
Yes.
sober and clean,
Yes.
without having to use drugs. So what's really heartwarming is to see, for example, 20 women from the Morningstar community residents come and dance and have a good time and be sober and clean and tell us how much they love it and that they can't wait to come back next year. And, you know, another 35 people from Phoenix House, and to see them dancing their heart out all night long and having a great time, clean and sober, and eating
And I bet
and
there's,
being
and
with
there's no
company.
fighting,
and
right?
Never
'Cause
been
if
a
you,
problem.
If you threw a little alcohol in there, I'm
There's
sure that you'd end up
never
with
been
a brawl.
problem.
Right.
This will be our 7th year in a row that we're doing this. As you mentioned, we give away scholarship awards to people in recovery or family members of recovery. You know, particularly we're looking for folks who want to contribute to our effort to
Yes.
help address the epidemic. Sometimes they want to be counselors or social workers, or we've even donated money to folks in recovery who are struggling that need money to pay their rent. So we're not, you know, really limited. We review each nomination carefully, and then the committee selects people. So we're proud to say that, you know, with this coming year, we'll have given out $6,500 over 7 years. So
Wow,
you know,
that's awesome.
That's significant for a little community group like ours.
I also think that the power of showing young, especially young people, because it's the time of their life that they're out in clubs, that they're out doing things. And they need to know that they still can do all of those things because people, places, and things. So they have new friends, and they need to find a new avenue to just enjoy themselves. You know, unfortunately, society does revolve an awful lot of things around alcohol, especially. And alcoholism is still the #1 killer, I do believe.
Yes.
So I know we have young people in recovery also. We have Tatiana Green, who is an outstanding example of
and
being
a new
involved.
Lyra board member, by the way, Tatiana.
Oh, congratulations.
Yes.
I didn't know that. That's
Yes.
awesome.
Yes.
Yeah, she's a powerhouse. I was very honored to do Combat Heroin website. You know, and I do a lot of, you know, people that reach out to me, family members. I bring her in, and she brings me in to speak to parents, and we've really had a nice relationship building. She's an incredible young woman.
Yeah, absolutely.
Yeah, and if we can do some good work in the interim, all the best.
Yeah, you've both been featured prominently in the Oasis PSAs. I'm home watching TV at night, and I see Linda come on. What a special treat. Linda stopped by for a visit.
It was, you know, when that launched last year, I was brushing my teeth, and I thought, I hear me.
You heard yourself?
It was a little odd, but, you know, I'm happy to give my voice because as much as the shame and stigma goes for the person struggling with the disease, the shame and stigma sticks with the family. And enough with that. Enough with that. I am not ashamed of what happened to my son. It's a tragedy, and people should think of it as a tragedy. If, you know, they would have thrown a spaghetti dinner if he was suffering from any other disease.
Right.
But, you know, oh, is that what's going on? It's there is no shame, you know, and it can happen to anyone, anytime, any place. And that's been proven again and again and again.
Absolutely.
Rich, poor, there is no sector that goes untouched by it. So is there a way that people could sponsor or send you donations?
Sure, absolutely. I mean, we do have flyers that we're circulating. You can go to the Lyra website, which is lira-nys.org.
Okay.
The Lyra website. There's a flyer there. There's information there. We'll be generating things. We have a big email listserv, and lots of our friends and folks are helping us distribute. You know, we go from event to event. We went from the big walk, which was enormous and tremendous success, to Rock and Recovery, to Unite to Face Addiction. So we just keep pushing the next event out there, and we'd love to have sponsorships, people who donate and help sponsor the event. Contributes to our modest coffers, and with that money we're able to do things like charter buses to take people to do things like that. So there's a lot of give back.
And you also do the bus in February for Advocacy
Correct.
Day.
Yeah, we do.
So
Albany
advocacy. Let's talk a little bit about that.
We could talk about this all day.
Oh, we could talk about that all day.
Yeah.
But we, to be an advocate doesn't necessarily mean that you have to do any talking, correct?
Correct.
But there is power in numbers.
Yes.
And when we all come together and show a force, things get done a lot quicker than if, you know, it's the same people showing up all the time. And the same people show up all the time and do a lot of work behind the scenes.
Right.
But on those particular days, we need people to step out and share their stories.
Yes, we do. Absolutely.
So what would you like to say for, you know, just to get involved, for people just to get involved?
Well, I mean, I think I want to just speak a little bit to what you just mentioned, Linda, and we have a perfect example of the effectiveness and power of advocacy right here in New York. I think that we have developed a model, maybe not intentionally even, because we have many different groups that are all important and significant and potent, who advocate for different things. But if we go back to 2014, last year, when we had those incredible victories,
Yes.
with the Senate task force hearings that kicked off here on Long Island, and you know we were all part of that. I don't want to forget to mention our breakfast meeting with Senator Boyle
Yes.
that time
Yes.
there too. But like to acknowledge Senator Boyle too, because, you know, in my opinion, as the chair of the Alcohol and Drug Committee in the Senate, he did more in his role there in his short tenure than anybody in modern memory. So
Yes.
we're real fortunate to have Phil Boyle on our side. And
on
so,
Long Island,
even better, right?
even better.
So the point I'm trying to make here is that we had people in recovery, we had family members of people in recovery, we had family members who were impacted by addiction, we had family members who lost a loved one, we had prevention coalitions, we had treatment providers, we had everybody together in 2014.
Yes.
We were able, if we needed to get in a particular senator's ear in the North Country, tap into our resources in that area and generate what it is that we needed to help affect change. And the fact that we're here now and we're so well connected and plugged in New York State has been it's been quite an undertaking. It took us a long time to get there.
Yes.
But now we have those resources at our disposal where if we need something to get done in Buffalo, you call Avi Israel,
Yes.
and we move the ball that way, or we need something in Syracuse, we call another person. And so I think it's just great that we've been able to do that. So to your point about advocacy, yet no, you don't have to say anything. A lot of people are uncomfortable or, you know, feel a little bit awkward. That's great. Just come along for the ride. Watch what we do.
Observe.
Speak if you choose
Yes.
to. Don't speak if you don't want to.
Exactly right. Whatever your comfort zone is.
Right. So,
You know, and the best people to do that are people that are affected. So, you know, families together, that association, to
Another
work
great
for
group.
them, you have to have been impacted by a family member.
oh, is that true? I didn't know that. That's great.
Yes.
That's great.
So, you know, we need to, when you can speak from experience, that's powerful. You know, and I think that was the problem before families got involved. Senators or assembly people in New York State listening to the treatment providers thought that it was going to benefit them in some way, shape, or form financially. It had nothing to do with that. It was the ability to do the right job for everyone involved and provide treatment.
I agree. I think that this is something that we've been talking about for a very long time. 10 years ago, we were talking about this. You know, we're fortunate enough that we have some great treatment providers down here on Long Island that support everything that we all do. And the fact that they were willing to work with us, you know.
With the right heart.
Absolutely, with the right heart. And we knew that, but like you said, you know, the perception is, oh, this is just about profits for treatment providers, which is not the case. If they happen to benefit down the road because of this, that's great. Who cares?
If they
However,
happen to get people well,
yep.
and if that's the benefit, because that is the benefit, and they are entitled to, you know, cost is associated with getting well.
Of course, they're in business.
They're in business.
Right.
And that goes for not-for-profit also. It still costs money to provide treatment for someone.
Absolutely.
And on that note, we'll be right back after this message.
Hi, I'm Tatiana, and I'm a person in long-term recovery from heroin addiction. It was really, really hard, waking up in the morning, not knowing what to do, needing my next bag. I was so lost, but I'm here today to tell you that there is a solution. When I was in my active addiction, I didn't realize that there was another way of life. I thought that that was the only way, because it felt so good to get high, but it was all an illusion, and I didn't realize that. But today, being 4 years clean and sober, my life is absolutely amazing. I'm able to travel, I don't need a drink, I don't need a drug. I'm just happy being with myself. I couldn't understand for many years why was I doing this? It's because I was an addict, but I didn't know it. Today, many kids are becoming addicted to drugs and alcohol, but they don't know exactly what they're getting into until they're out of it. And it's our job, it's my job, to stand for these kids, stand for their recovery, and fight for their addiction. So I'm the president of Onward Forever, and I provide recovery services and support. And we're here to help. We're here to just listen. Anything that we can do to help. If you need me, this is how you get a hold of me. Please call 347-244-1550. 347-244-1550. I developed this company to help you, our families, and our community to fight this crisis on Long Island and in our nation. Thank you.
Welcome back to Long Island in Crisis with my special guest, Rich Buckman. So we were talking about advocacy.
Yeah.
And, you know, if you can't complain about a situation if you're not willing to step up and lend a hand.
Mm-hmm. Well, that's what we think, right?
Yeah. Well,
all comers are welcome.
You know, and as you know, I go back to 2014 when Lori Carbonaro, 9 weeks after losing her beautiful son Nicholas, was on the bus.
Yeah.
And you know, she did speak out at the press conference, and I know all she wanted to do was hold my hand. And for a little girl, she did a good hand holding.
Yeah. And she's come a long way in a short time.
And she's come a long way in a short time. And you know, we talk about that. So that was apparent on Sunday too. Whether you lost a child or you have a child struggling, we can all be together and understand exactly where you are in your walk with whichever your walk is. You know, and I will say, you know, the moms who have lost children and the dads, for us just to be together and to be able to talk, laugh, cry, scream, whatever you need to do. Nobody's looking at you saying, I can't believe you're laughing, you lost your child. You know, the unfortunate part is tomorrow's going to come whether you want it to or not. So it's how you handle tomorrow and what do you want to make of the rest of your life. That counts at that point in time. So the next thing I do, so we did get the bill passed for access to treatment. That fail first was no longer an option, which was my biggest thing.
Absolutely.
You know, failure at outpatient is the stupidest line I've ever heard in my entire life.
It's criminal that they got away with that so long.
It's criminal, and it's criminal to hear, which still he's not high enough for treatment. I still can't wrap my head around that. However, coming into this year, what I've known speaking with other families is everything now is medicine-assisted treatment. So you don't need inpatient still. We'll get you on Suboxone and you'll be fine.
Right.
Now Suboxone, well, tell us about, I know I used not the generic name, or I didn't use the name of the drug, I used the name of a company. So talk to me about the medicine-assisted treatment.
Well, I think what's really become focal, if you will, now is at the federal level, the federal government is pushing medication-assisted treatment as a way to address the opiate epidemic. I think it's promising. We do know that more so the Suboxone thing seems to be going by the wayside a little bit in favor of Vivitrol, which cannot be abused, and you know, has promising preliminary results from some of the research.
It's not a
So-
cure, though.
No, it's
I
certainly,
think that people need to
certainly not a
really,
cure.
that's the point that has to be hammered home. It's not a cure. It's to assist you. So, you know, you
Right.
don't have those little bad voices talking to you about wanting to get high. But it needs to be, you still need to be in an intensive outpatient program or in a 12-step fellowship,
Right.
but you need to be working on your mind.
Absolutely. Absolutely. It's something that was missing during the Suboxone years when Suboxone was really the #1 adjunct with medicine. Many people were getting Suboxone. They were not doing the counseling part that
Yes.
they're supposed to be doing. As the regulations indicate, they were not doing that. Doctors were not making them do that. You know,
And
so,
doctors were getting
you
rich.
know,
I will also say, all of a sudden it was cash only for a
yeah,
prescription and
right.
an office
The
visit.
insurance couldn't cover it anymore. I guess the fortunate thing, if you will, is there was a limit on the number of clients that patients that a doctor could see. I think it was 35 at one time. Hopefully they'll raise that cap too. But there's definitely a place for medication-assisted treatment.
Absolutely.
We need to, I mean, we're talking about a medical condition here. It needs to be treated medically. It needs to be given the credibility and you know, equal footing like all other medical conditions. So I think it's promising, but at the same time, I do think we need to monitor it very closely and make sure that the clinical components, you know, accompany the medication-assisted treatment, because there's a whole other area of social factors that need to be addressed in addition to getting the medication.
There was a film, and I don't recall the name of it. It was, though, about a doctor up in Vermont, a country doctor who saw the epidemic affecting his community. And he was a pediatrician, and he got trained in Suboxone. And it was such a well-made documentary. But he would have these kids come in, and the young people felt so strongly about him because he cared about them enough to sit and spend some time with them. They were drug tested. They had to have the right level of Suboxone in their body. And if they didn't, then he wanted an explanation. And they were held accountable. And when he called the treatment facility that he worked with, if they weren't going to their meetings, well, then they didn't, you know, then their prescription was in jeopardy. So all of those things working together created an amazing outcome. So, you know, if we all, again, come together with the best intentions, and the best intention is not the almighty dollar, you can still earn a living. So, and that's important. I don't mean to begrudge anybody.
Yeah, of course not.
That's fine. But you need to do the right thing for your patient above everything else, because there's way too many doctors. You know, Terry Kroll and her son, who reported that doctor, there's way too many drug dealing doctors, and more and more and more of them are being reported and being held accountable. And they're losing their licenses and they're going to jail because this has to end. The nurse practitioner that just was sentenced.
Right, yeah.
What was it, $2.5 million she earned or something, something ridiculous like that. It was crazy.
Wasn't it right here in Deer Park? I
Right
think,
here
right?
in Deer
Yeah.
Park. Right here in Deer Park. And shame on her for, you know, it's terrible. She is nothing more than a drug dealer at that point in time. So, you know, we do need to recognize all of these things. But if you're having a problem getting treatment, what should you do?
Well,
What do you feel?
Statistically, we know that, you know, less than 10% of the people who need treatment get it. So what are those barriers? They continue to be stigma, not knowing how to go and find treatment, a lack of availability of treatment, insurance limitations. So there's a number of different kinds of things. But we have, you know, tons of resources. Oasis has a 24-hour hope line that
Yes.
people can call at any time.
And they have the website, www.combatheroin.ny.gov.
There you go.
And it's not just for heroin. You can find any treatment provider in your county, in your your city, right on the website. You can educate yourself with the videos and there's tremendous tape, you know, videos available on there to educate yourself as maybe, you know, especially as the family member of the one struggling. And then, you know, find your help. Because the family, whether your loved one seeks help or not, they need to get help also.
Absolutely.
That's the key, too. You know, you can't, because too many siblings or, you know, have voices that go unheard, and parents are suffering, and it's, you know, you need to empower yourself, and you need to, I guess, I just read this sign last night. If your family member who's struggling is angry at you, then you're not enabling. And if they're pleased with whatever's going on in your home, then you are the enabler. So it's not, you know, they are going to get angry, and they want what they want when they want it. And that is part of the disease, and they will humiliate and manipulate and lie and cheat and steal to get what they want.
Yes.
And I think people, you know, we talked about this the other night. I read a poem that Lindsay, Angelina's daughter, wrote. And for me, heroin is the devil himself, because I know Thomas. I miss Thomas, my son, every second of every day. Thomas the addict, I don't miss any second of any one day, because he was not my son.
Right.
He was a host for a disease and a drug to do very incredible, nasty things. And that wasn't him at all. You know, we all need to remember that people struggling with the disease are excellent people, but they struggle with the disease.
Right.
And what Robin Williams did last year when he committed suicide for the disease of depression, we need to remember that we all struggle with something. Nobody's walk is easy. But let's talk about, you know, let's talk about that. Robin Williams also struggled with the disease of addiction. Underlying factor was depression. So when we take away the veil of the disease of addiction, you may find what truly is, you know, bothering the person struggling, correct?
Yes.
You know, you'll find the underlying issues that can finally be resolved to go on and live. I mean, you're a shining example of a life well lived. You know, Anthony Rizzuto also. There's so many people that are willing to come out now. I Am Not Anonymous website.
Right. Good stuff.
And how do you feel? I mean, it's a personal choice whether you choose not to be anonymous or to be anonymous.
It is a personal choice. It's always a personal choice. What we're hoping is that the folks that see what and how we do and why we do it come to understand that there is a way to participate in this recovery advocacy movement while still respecting the traditions of a 12-step program if you happen to belong to one. So there is a way to advocate and be respectful. Advocacy with anonymity is something that can be done, but a lot of people are not open to it, which is okay. You know, their time will or will not come. But for those of us who are out here, I mean, I happen to belong to, over the years, I've belonged to a number of different 12-step programs, and I've been doing this stuff for a long time. Never once have I ever identified myself as a member of a particular 12-step program. It's just not something that I would do, because those things are near and dear to my heart as well. But does not mean I can't stand here and say I'm a person in long-term recovery. And you know, for me, that means it's 27 years since I got clean and sober after ending up homeless and hopelessly addicted to alcohol and cocaine. You know, fast forward 27 years, here I am. I'm a contributing member of society.
What was your defining moment that you chose to seek help?
Well, you know, there's something that I read a long time ago, after I was clean and sober. It was a phrase, and I can't think of it off the top of my head, but sort of like when you get to a point where you can't live with your alcohol or drugs, or you can't live without your alcohol or drugs. When you get in that spot, for me, that's what happened.
Okay.
I realized that I hit a place where I felt totally lost, unloved, helpless, nowhere to turn. And for me, it was that defining moment. Now, that's not to say that in my mind I thought I was going to go and stop drinking or getting high. That wasn't my intentions.
Right.
My intention was to go away and rest up and get a tan and come home and, you know, and look good for the girls and all of that stuff, and then, you know, just do it on the weekends. And then when I got to treatment, which is why inpatient treatment is so important,
Yes.
it changed my entire focus, cracked my denial open, explained to me exactly what it is, what was going on with me, and from that point forward, never had to drink or use drugs again. But that's not why I went there. I went there for the reasons I said to you, and I had an eye-opening experience, you know what I mean? A Tiffany moment.
Yes.
And more people need to deserve to be able to have a Tiffany moment, which is why we need to continue to go after these insurance companies.
Absolutely. You know, it's mind-boggling because if I, God forbid, had cancer, what's the magic number for remission? 5 years, right? So I would continue to get treatment, though, for the rest of my life,
Right.
whatever that treatment would you know, encompass.
No questions asked.
No questions asked. But, you know, and I use this example with the president of the New York State Insurance Plan. If, God forbid, I had breast cancer and it's a fatal progressive disease, and my insurance company said, we want you to take vitamins and go to a support group
Right.
for 6 months. We know you'll be much worse in 6 months, but we need you to fail at this particular option that we're giving you, and then we'll see what we're going to do for you. There would be outrage in everyone's mind. How could you possibly do that? But why is it that with the disease of addiction, and I almost feel that death is a treatment option that insurance companies go for. I really almost feel that way because we lose way too many people waiting to get into treatment, coming out after 6 days, you know, and then say, see, treatment didn't work for
Right.
them.
Right.
Baloney. You would not say that to anybody who's fought cancer, who fights diabetes, who fights heart disease. You know, with diabetes, if I choose not to exercise and lose weight, I still get my medicine.
Right.
And they continue to up my medicine. They'll do surgery and remove body parts as they get, you know, as I get sicker and sicker. But never is it said to me, we're going to withhold treatment because you're relapsing. You're not
Right.
doing what you're supposed to do. So what makes it different
Well, I
for
think-
that disease?
I think one of the issues is that there's a behavioral component to addiction, so people see individuals acting in a certain way and think that they should be able to control that behavior and make the necessary adjustments, not taking into consideration the psychological factors that go along with that, and combine that with the biological stuff. So it's a complex disease that sounds like it's simple, but it's really not. So I think when we think about
It's not a choice.
it's certainly not a choice,
It's
but
not a moral
people-
failing.
But regrettably, there's still a perception out there that it is a choice.
I
That
know.
it's moral, that they're weak-willed people, that they shouldn't have to do that. And it's not about that. It's really not. On some level, fortunately, that perception is changing. We are
That, God
making some
willing,
progress,
it
and we have a
changes.
long way to go still.
Yeah.
Linda, we do.
I know that other parents or other people would say, you know, for me with my son, take his phone away.
Right.
Well, that'll be very effective
Yeah.
because you have no concept of what I'm dealing with. No concept. It's not a choice that he's making. He's not behaving. He didn't wake up one day and say, I don't want to play Division I lacrosse. I want to be a heroin addict.
Right.
I want to destroy my siblings. I want to destroy my mom. I want to kill myself. He never woke up one day and uttered those words, as every other person that we've lost to the disease of addiction. It was not a choice. Unfortunately for them, I like to, for me, with my understanding, and to explain it to other people, he didn't have the shutoff valve that allows some people to say, I'm going to have a couple of drinks and you know, watch the football game, and then I'm going home. For the person struggling with the disease of addiction, it'll be, I need to stop and get more and more,
Right.
and I need to keep this party going. Does that make them bad? No. It just makes them, you know, it's a...
Sick.
Yeah, makes them sick. Right. You know, I would even, everybody's been on a diet, so...
I could use one now.
Right, can you, but You know, is it easy to give up what you want to eat? No, it is not. And that may be a very simplistic way to look at it, but it really is the same. It's the same thing, right?
Yeah, I mean, I think there's a component that the layman does not understand,
Yeah.
which is, I mean, there's a couple of ways to describe addiction. I mean, as you may know, I'm also a clinician, and I've worked in the field for a long time. There's a component to this where the person cannot predict with any degree of accuracy what's going to happen once they ingest that first drink, that first drug. They may have intentions of going out and doing a couple of things and then being home by midnight and be able to do that the first night. The
Right.
second night they go out with the same intentions and the same plan. It ends up, it's 4 o'clock in the morning, they have a DWI, they crashed a car, they're found with a syringe in their arm, yet their plan was the same as it was the night before. Why was it different? That's the mystery of addiction. So
Yeah.
there's a biological component that's clear.
Biological,
and people,
psychological.
multidimensional.
Yeah.
It biopsychosocial, you know, it
Yeah.
encompasses the whole individual.
But, you know, once the drug or the drink goes inside of you,
All bets are
it
off.
does. It not only affects your mind, it affects every organ in your body, every cell in your body.
Absolutely.
So how can we, you know, hold people to all of that without, you know, some semblance of patience and compassion. Compassion is the word. You know, there, by the grace of God, go anybody not
Yes.
struggling. And we'll be right back after this message. Oh, okay, we're going to keep going because we're almost done with the show. I know,
Okay.
it goes so quickly.
All right.
What would you like to wrap up with, Rich?
Wrap up with, I mean, I think we just want to, those of us who are in this battle on a daily basis, like me and you, we want to encourage more people to come out and be part of who we are and what we're doing, whether it's getting involved directly with Lyra or FIST or volunteering at LICAD or
Any one of
other
those.
organizations. Just do something. We need you. We need your voice. We need your face. Sign up. Go on these websites. Give us your emails. Come with us on bus trips. Be prepared to contact your local representatives if we need you to help us with a particular
And that's been
legislative issue.
the, you know, I know you were there when FIST, really, the name was born. Families in Supportive Treatment. Individually, we are not as strong, but when we come together, we are a powerful force.
Yes.
And in 2014, with everyone making those calls to their state representatives, it changed what happened that year.
Absolutely.
It changed what happened. They hate getting phone calls. Phone calls, emails, fax, especially email, fax and phone calls, because they have to address that. So I think, you know, any contribution is worthy to be made. Any. It doesn't have to be big. It's never considered small. Signing your name to a petition, making a phone
Exactly.
call, sending an email is vital to what goes on with our organization. You know, and FIST is growing exponentially. We saw that on Sunday with the recovery walk. Families want to, they need to, and they have to come together.
Absolutely.
Because there is strength and there is compassion among each other. And, you know, that's going to change how we come out of this epidemic. I mean, I always want to think we're doing better, and the unfortunate reality of it is, I don't know how far we've come far, but there are still way too many people dying, struggling, and it keeps changing its ugly face. Something just keeps popping up around the corner. You know, what would you say to parents with young people?
I mean, I think as never before, there's a time, there's a place to connect to other people who can guide you and mentor you, people, you know, wonderful parents such as yourself who are so dedicated to this mission. And I think the one thing that you hit on earlier is that the family presence in this movement has been, in my opinion, the most potent addition to the movement that we've known. And it's having an impact, and it's making changes, and it's getting people to listen.
Yes.
So we need more family members to come out here and join us.
Absolutely. And on that note, I could not end the show any better than what Rich just said. We do need to be families united to face addiction. Come out, Rock and Recovery Dance, Friday the 25th. And then the following weekend is the Fed Up Rally, Unite to, I don't want to say that.
Face addiction?
Unite to Face Addiction with a great lineup of performers. And then Advocacy Day on Monday. Do whatever you can to get there for any one of those events. Or send your emails to our federal legislators. I think that's important. Thank you so much for joining us this evening. I look forward to seeing you next week, and have a safe, blessed week. Good night.
Another dark hotel room.